The year was 1971. Apollo 15 landed on the moon. Richard Nixon was president. Roberto Clemente of the Pittsburgh Pirates was named World Series Most Valuable Player. And Three Dog Night topped the charts with Joy to the World. And the first open heart surgery was performed at Memorial Mission Hospital. Today, the vision and sacrifice of a small group of talented surgeons, cardiologists, nurses, and administrators has resulted in Mission Hospitals being named one of the nation's top 50 hospitals for heart and heart surgery. But becoming a nationally known heart program didn't happen overnight. It occurred one careful step after another. It started with the vision that coronary bypass surgery options were needed for patients in North Carolina's western region. That rheumatic fever patients needed a place close to home to have their damaged heart valves repaired. It began with designing the Fullerton operating rooms to handle open heart surgery. It began with the first patient. The days leading up to that first open heart surgery were filled with excitement and anticipation. Equipment and procedures were checked and double-checked. The surgeon's training prepared them well for the procedure. What no one knew was how that procedure would impact the future of healthcare at Mission and throughout the region. And the impact came quickly. As the number of heart surgery patients increased, it was apparent that the hospital's pulmonary care services needed better equipment and more experienced staff. Specialized intensive care units and operating rooms for heart procedures were needed. More cardiologists and surgeons came to Asheville, attracted by the quality of medical care and the quality of life. And in 1995, the Owen Heart Center opened for business. Today, Mission's heart program is a nationally recognized quality leader. First came Solution. For 2 consecutive years, Mission has been named a top 100 heart program. Second came U.S. News and World Report. The July 2003 issue ranked Mission as one of the top 50 heart programs in the nation. And this year's Health Grades rankings prompted Money Magazine to name Mission Hospitals one of the top 5 centers for heart care in the Southeast. Amid all of these accolades, it's easy to forget what things were like 30 years ago. In those early days, there were no designated operating rooms or intensive care units with specially trained staff. There were physicians and nurses who stayed at the bedside through the night. There were a few people with a big vision. From diagnosing heart disease to post-operative care, that vision has become a reality at Mission Hospitals. As we celebrate 30 years of excellence in heart, we pay tribute to those who had the vision and those who embraced it along the way. New medicines, diagnostic equipment, medical devices, and surgical techniques are dramatically changing the way heart disease is treated and the options open to patients. What hasn't changed is the need. Heart disease remains the leading cause of death among men and women in western North Carolina and the nation. Among minorities, death from heart disease is alarmingly high. It's clear that our mission extends to prevention. That is why in the coming years, Mission Heart will be reaching out in new ways with screenings and education. Today, as it was 3 decades ago, our focus is still on each patient. Our goal is to provide each person the best care possible. Our vision is to continue providing the residents of western North Carolina and beyond healthcare options that will improve their lives.